Hello everyone, welcome back to my channel. Today we are going to talk on a very important topic which is almost concern for each and every couple who are married or unmarried. So we are going to talk about emergency contraceptive pill. What exactly are we getting in the market? Are Ipills or unwanted 72? So by the name itself, unwanted 72, it means that it can be taken anytime after unprotected intercourse or unprotected sex, or if in case there is breakage of the condom which you are using for physical protection, or if you have missed the oral contraceptive pill of more than 2 days, still you need to take this protection when you are having intercourse during the fertile days of your cycle. So this is an emergency contraceptive pill. So what are the various names by which it is available in the market? First is Ipill, second is unwanted 72, and also it is also called as morning after pill. Why? Because it can be taken the next morning when after an unprotected intercourse. Till how long can a girl take this after unprotected intercourse? With maximum efficacy, with a pregnancy rate of only 0.8% chances, as the name suggests, unwanted 72. So it can be taken anytime safely till 72 hours or up to 3 days after the unprotected intercourse or breakage of the condom, for example. So fourth question, what are the chances of pregnancy after taking Ipill? So the chances of pregnancy according to the trials is about 0.8% if it is taken effectively within a period of 72 hours after unprotected intercourse. However, it is 1.8% if it is taken up to 120 hours, that is 5 days. So the maximum duration up to which you can take is 5 days, but the maximum efficacy is up to 3 days of unprotected intercourse. The best advice given to the lady after unprotected intercourse is to take it as early as possible. Mechanism of action, how does it work? So basically this is a single pill. It is just a single pill which contains hormone progesterone, and in this what happens is that it makes the cervical mucus thick. Also it affects the lining of the uterus in such a way that there is failure of first fertilization. It prevents the sperm from meeting the egg and therefore prevents fertilization, that is the baby formation. Secondly, it also impairs implantation. So what are the side effects? So the side effects, the common side effects noticed are there can be just nausea, or there can be vomiting, there can also be dizziness, there can be breast tenderness once you take it. Sometimes patient feels tired. What are the contraindications? If a lady is already pregnant, her UPT pregnancy test, that is the urine pregnancy test, she has tested at home after missing her periods and she comes out to be positive, this Ipill is not used for terminating that pregnancy. This is just an emergency contraceptive pill that one can take after unprotected intercourse. So it will only prevent pregnancy. However, if she's already pregnant, there is no point taking this tablet. Person should not drink alcohol while taking this. So now what if she vomits, if she has a side effect and she vomits after taking the Ipill? So if she vomits within 30 minutes of taking the Ipill, it is advisable to take the dose again. However, if she vomits beyond 30 minutes, 30 to 60 minutes, it is advised not to take the Ipill again, because it is presumed that the absorption of the pill has already taken place and you do not need to take the pill again. Next very important question which is asked is, how often can this emergency contraceptive be used? It is advisable that once in a blue moon, if there is unprotected intercourse or you are confused about whether your protection was broken, for example the condom was broken or not, and also if you are confused that within your fertile days you had unprotected intercourse, you are not sure, then you could use an emergency contraceptive pill. As the name suggests, it is just for the case of emergency. This cannot be used as a routine contraception. You cannot always use it every cycle you have unprotected intercourse. If you have such complaints, you should go to a gynecologist and start a 21-day regime of oral contraceptive pills which are available, which gives protection throughout the cycle, irrespective whether you have intercourse anytime during the course of a menstrual cycle. So it is not advisable to take it every month, as it can cause irregular bleeding and it can create problem for the lady during her menstrual cycle. What happens if you miss your periods after taking an Ipill? So if the periods are missed even after taking the Ipill, it is advisable for you to consult a doctor or check a urine pregnancy test at home once you miss your periods, because there are failure rates of Ipill also, which is the pregnancy rates seen is 0.8 to 1.8%. As already told to you before, depends upon how early are you taking the Ipill, within 72 hours or within 120 hours. Thank you for watching this video, guys.